Take videos here. Hey, did you record all of yesterday's video? Some.
Just anything related to me.
I'll make a video for you.
I don't know how.
I'll send you a Google Drive link.
Sure.
We can drop it down.
You can create for the group so I can send pictures from there.
Sure.
Even the hair transplant content.
Yeah, I will.
I took a video. Send ko na. Kagawa ko ng 8. Pero enjoy. Were you did you attend the gala? Were you there?
I missed it. I was late.
O siya sa Pilipinas, papakabog. Kanta ka na. Wala niyo si Bakang? Hindi, nandiyan po pero ano na wala na ito. Meron na. Nakita kami sa hindi ko alam kung gagawin ko kasama ko hindi mo yan yan na yung person kumain na kayo na coffee talaw pa yan awan na ka na coffee meron na kumuha ka na ng ako saan ito amay support ko ano kinatanda dami na pero parang concern kumakpak na naman sa kumakpak na natin siya lakad.
Hello everyone, sorry for the delay. It's a very nice time for my talk because we just had witnessed a wonderful talk on the use of HA and VLA. We also had a discussion on beauty and its perception. So now I'll talk about facelift, surgical versus non-surgical. Since I get patients of both types, there are the ones who don't want to undergo the blade, and then there are the ones who want to do surgery to get a long-lasting result. But I believe you need assessment. You need to know the philosophy of beauty, aging and its effects on facial appearance, the concept of a facelift as a rejuvenating procedure, and the goal of a facelift to restore a more youthful and refreshing look. And you need to know the use of scalpel, the blade, versus the needle. So if you Google beauty, what is it? A feature of objects that make them pleasurable to perceive. And what is aesthetics? A branch of philosophy that deals with the principles of beauty and artistic taste. We can tell you how to use a filler. I can teach you how to do a filler. But I cannot teach you how much. You need to develop this perception of what is beauty. How would this person looks better, younger, more youthful? This is something for you to decide. Once you have that image in your mind, you'll be able to replicate that on the face of your patients. If you go in without knowing, without understanding what looks good with that person, it's more like a well-tailored suit. It has to be tailored to my particular size. Otherwise, even if it is from the best brand in the world, I won't look good in that. This tailoring is your job as the treating physician. So, beautiful faces, how the world sees them. Miss World contests, Miss Universe. And how a plastic surgeon sees them, it's a blessing as well as a curse. Because when I look at someone, I divide the face into thirds, I divide it into fifths. All the colors go away, and this is how I see a face. The thirds and the fifths. The concept of golden ratio. It is very old, and it is something that has been applied to a lot of things. It is found in the pyramids, the Mona Lisa, photography, and very deliberately in corporate logos. That's why it's called the golden ratio of beauty. There's a pleasing simplicity to the equation as well. This is how it looks. So there is no one right answer. Beauty is subjective. It's philosophy. It's not science where you have 2 + 2 = 4. This philosophy is important, and I believe everyone can learn the skill of injections. Everyone can learn the use of energy-based devices. Everyone can learn how to do a facelift or a rhinoplasty. But who needs what? That's what differentiates a good from a world-class surgeon or a physician or an esthetician. So it's your job to have this philosophy where you understand what would look good in my patient. Now, the golden ratio applies to a lot of areas, but at the same time, Bella Hadid, she got 94% most beautiful woman in the world, but there's a way of scoring with the golden ratio. But now the problem, the same golden ratio cannot be applied to everyone. If we applied it to his face, it's not looking good with the golden ratio. Look at this, the golden ratio version. Then we come back to that same point again. It's the perception, it's the philosophy. The same golden ratio looks very good in Taj Mahal, but it doesn't look good here. And what is true beauty? It's subjective, but there are certain parameters that can help. One is symmetry. A lot of patients would come in and they'll tell you this side and this side. We like symmetry, we call it beautiful. Look at this wall, you have straight lines. Look at the screen, there is symmetry everywhere. So trying to achieve symmetry could be one step in achieving beauty. But remember, nature is beautiful and nature has no symmetries. Everything in nature is asymmetrical. Only we humans create straight lines. So understand, symmetry is one of the guiding principles, but it is not the only one. You need to look at the proportions overall and the proportions of each organ. You need to have a homogeneous skin, healthy volume in the right areas, soft contours. These are the principles that can help you decide what is needed in this particular patient. And most of all, appropriate for age. Say no, learn to say no, especially to patients who have very high expectations. Even as plastic surgeons, sometimes I say no. There are patients that I've said no to. Because they are the ones whose problem is not actually in the face, it's in the mind. He or she doesn't need you, they need a psychiatrist. Youth is beautiful, and when we have achieved everything else in the world, when you have worked very hard in your 30s, 40s, 50s, then you desire being young the most. The two sides. And you need to remember the triangle of youth and the square of an aged face. Remember this picture, because whenever you're starting your practice or whatever you have, for example, either a filler or threads or Botox, remember the basic problems that lead to this triangle becoming a square. So whatever you do to reverse the square into a triangle is going to look good. So this is where we need facelift, which is the art of reversing age. Always remember three things: volume, gravity, and skin laxity. Whatever you plan for, you plan around these things. For example, volume. Why do we use fillers? We just want to replace the volume. Gravity. This is the force acting on us throughout. Whenever, every day, it is the gravity that is pulling everything down, and the skin laxity. So you need to replace volume, do something to counter the effects of gravity, and finally, do something to improve the skin laxity. If you're able to do these three things, your patients would be happy. Just a very quick overview of facial compartments, because we are talking about volume. So with age, we lose these fat compartments, the superficial and the deep. And that's why the concept of a surgical facelift is changing as well. Replacement of volume. Now, very basic anatomy. You have skin, you have fat underneath, and then you have some ligaments connecting the bone to the skin. Everything sags, everything goes down. So the volume, which was with very soft contours, now you have lost volume. The skin laxity is gone. The gravity is pulling the towel down. This is aging. So whatever you do to fill up this or this or this, lift the skin up, is a facelift. Whether you do it with needles, whether you do it with a blade, whether you do it with some energy-based devices. So loss of volume is a major problem that in aging. Apart from that, fat loss. You lose 1 teaspoon of fat and bone each year after the age of 25. So by the age of 50, half a cup of facial volume is lost. This is where we need fillers. You have to replace the volume. Bone, there are certain fillers, even the video before when my colleague was injecting here, she was doing it at the bone. We need to replace volume at the bone. We like to replace it in the cheek, at the bone. Sometimes in the jawline, we go at the bone because we are losing that bone mass. Now I'll talk about the main topic because this background is important. You need to remember, beauty is subjective. You need to remember volume, gravity, and skin laxity. You having that in mind, we discuss the needles first. We have a few options when we are doing the needles. We have Botox, fillers, and threads. From last 1 year now, in my practice, I have changed the concept of Botox, fillers, and threads. I do not allow my patient to decide what to do. I have a clear cut. There are two plans: a surgical facelift with these charges, a non-surgical facelift with these charges. That's it. Then I decide which ones to use and where. I give them an idea. We are going to do this. I want to, let's say, do the nasolabials, I want to leave the wrinkles, I want to lift the cheek, but I decide what to do. The problem with Google and ChatGPT now, and most of all, the problem is actually Snapchat. The filters that the Snapchat has on, people love them, and they come back and they show us those filters. It's impossible to replicate Snapchat. Even this morning when I was having breakfast, one of my patients who had a rhinoplasty, she sent a picture made in a Snapchat filter, and there is asymmetry to the face. If the face is asymmetrical, let's say at the chin area, and you're creating a nose, you have to leave a little bit of asymmetry, because if I have a very straight nose and I have a deviated chin, that looks odd. But she had a filter that actually changed the forehead and the chin, and now she's saying that I need a nose as straight as this. So you need, because of all this, I've changed the concept. So I just tell my patients, I'll be doing a non-surgical facelift. Leave it to me, how many fillers I use, how many threads I use, where Botox. So it's all up to me. And the good thing is, all of these patients, they're very happy with the results. I'll show you a few. They desire a youthful appearance, but with increasing demand for minimally invasive, because when I do surgical facelift in patients around 50, the downtime is at least 2 weeks. In those above 50, the downtime is always more than 4 weeks. No one has that long. So we have to do the fillers to replace volume, the collagen stimulators, the main areas of concern. They have immediate results with smooth filler appearance, and it requires maintenance. So these are the areas that you can always think of whenever you get an aging face. Now the most important question is always, how much do we need? With the Botox, with the fillers, you get two types of patients. One who think about money, like they have a restricted amount to spend, and one who has a lot of money. Now, even if someone has a lot of money, you cannot go on and fill the whole face. You have to remember, less is more. That's for you to decide. So we have the Botox, and then thread lift, which is one of my favorite procedures. since I told you to remember volume, gravity, and skin laxity, I believe every person who has concerns with aging is related to skin laxity. So now I have this habit of doing threads in literally everyone. Because whenever someone comes in, the best volume replacement could be only threads sometimes. This is how I do threads. I do local anesthesia throughout, and then I go in. She's hosting a morning show in my country, and she wanted, look at the face here and the cheeks here. This was the change she got. I had to take this picture of her show, because since I was coming in, I wanted to show the change. Look at this here and here. There is no filler used. I just lifted the face. So all the volume that was sagging actually went back to where it should be. Only threads, nothing else. She wanted the cheek definition. She wanted the smile lines to be there because that's her sign, that's her beauty feature. The angles, they were already going up. It was just the loss of volume. You could have done that with a filler, but I preferred threads because I wanted to address the skin laxity. Now another patient, she's 55. She has a sad face, and I did a combination of Botox, threads, and fillers. Fillers were done in the nasolabial and a little bit in the marionette, with a little bit here to conceal the jowl. The jowl is still there, but I did a little bit of a filler here and here to give a smooth contour. This patient, he's a gym instructor, and I did a combination of threads, Botox, and fillers in the nasolabial. I also did fillers in the cheek, just to give him the volume. Another patient, she's also on screen back in my country, and she wanted this lifting of the cheeks. I just did it with threads alone. Now, this case is interesting. It's a 5-year-old picture. He came to me like this. He's an actor there. And he came in after a facelift. So I did non-surgical for him. There could be some risks and complications. I want to show this one because this one has threads.
Of the jawline, and it's still there. It hasn't really dissolved, and it is giving that very odd contour to the jawline, the line where at the point where people want.
This is the threads that were stuck. And it was a thread and the filler making a ball near the jawline. So it makes a surgical facelift that is difficult for us. Now, interestingly, it was only found on one side of the face, not the other. Now, since I have very less time now, so I'll just talk about surgical facelift very quickly. I'll skip the technique because that's not important, but I'll come down to the results straight away. Now, if this patient comes in, I cannot restore this with non-surgical. I have to do something surgical to produce the change because he's looking for it. Look at the excess skin. I can never hide it anywhere. So I have to do a surgical facelift. You can still see the incision. It's a 2 weeks follow-up. That's where you need surgical. One more patient. She wanted a longer lasting result. I could have done this with non-surgically as well, but she wanted a longer lasting result, so I went to surgical. This patient, she has a double chin, a big jaw, and she wanted a jawline. I also did the lower eyelid blepharoplasty in her case. You can see the lift, and the incision is still there, it's a 2 weeks follow-up. But you can see the change already. Another patient, she wanted a big change, she was sick of the jawline. I cannot do it without liposuction. So I did liposuction, I did a facelift. I also did a temporal lift because she wanted the brows. We'll skip these. See, a massive change. Upper, lower eyelid blepharoplasties. This case, the upper eyelid, the lower eyelid, the face, and the turtleneck, all done in a single procedure. And finally, one last video where I show you a combination of facelift and volume replacement with fat. We do the liposuction. Where you do the fillers, I'm doing the fat. Big quantity, always available, and wherever needed. There is a reason why I want to do this. Look at the change. She got a surgical facelift and correction of the asymmetry of the face. See that the face is asymmetrical. That was her main concern. But she also needed the lift, and I could only correct it with proper surgical facelift volume replacement. So the take-home message, understand the philosophy of beauty and the anatomy of aging. Chalk out the result in your mind before you start the procedure. Master the skills of both the needle and the blade, or if you're not a plastic surgeon, at least you should know which cases to refer to a plastic surgeon because they're going to create problems for you. Pick the one balancing the patient's level of deformity, desires, and your own expertise. Thank you very much.
Thank you, Dr. Salman, for your presentation. Are there any questions?